Aloha, I'm Dr. George Martin. I'm a practicing medical dermatologist here on the island of Maui since 1989. And I'd like to share with you some takes on TNF inhibitors and where they fit in 2023. Since etanercept was introduced to dermatology for the treatment of psoriasis in 2003, TNF inhibitors had been a mainstay for over a decade. And now with the advent of IL-12/23 inhibitors and IL-17 and IL-23 specific inhibitors, we have newer classes of drugs that have certainly demonstrated higher efficacy and great safety. So where do TNF inhibitors fit in today's world? And let me share with you two instances where I think you still need to keep them in your mind. So number one, in dermatology, and particularly psoriasis and psoriatic arthritis, adalimumab has been a mainstay of treatment for psoriatic arthritis. It is usually the gold standard against which other drugs are compared in terms of treating psoriatic arthritis and preventing radiographic progression. And so adalimumab is still a top tier in that domain. And again, in psoriasis, it still is an effective drug. Now, a second drug, certolizumab pegol, a TNF inhibitor, was a little bit late to the game in dermatology, but holds a very important role in the treatment of psoriasis, particularly in women of childbearing years. So whether you realize this or not, half of your patients of childbearing age, when they get pregnant, half the time it will be unplanned. And so you better have a pregnancy planning discussion with your patients on systemic therapies far in advance. And certainly we have demonstrated, not just in dermatology, but I think in gastroenterology, where IBD patients are treated throughout their entire pregnancy with TNF inhibitors safely, and even to the point, through lactation, the TNF inhibitors have been found to be very effective and safe in the treatment of IBD. And certainly the data in psoriasis is, again, consistent with that finding, that very safe, very effective in managing patients with moderate to severe psoriasis in pregnancy and through lactation. So certolizumab pegol, because of its structure, does not cross the placenta and does not get into breast milk. And we know through the crib and cradle studies that this data has been borne out. So when we look at the TNF inhibitors, all which are quite safe in pregnancy and lactation, following certain parameters, that certolizumab pegol is probably considered as safe or safer than all of them, just because of the way the molecule is built. And currently, I'm chairing the National Psoriasis Foundation guidelines on pregnancy and lactation. We've had this discussion and across the board, and TNFs as a class appear to be very, very safe during pregnancy, and with certain caveats at the end of pregnancy. You certainly, for most TNFs, want to remove your patient from that drug just before delivery to minimize drug on board with the baby, and then hold that drug maybe for 2 weeks prior to starting lactation. So I just want to share that with you. And there is still a role for TNF inhibitors, albeit very specific roles, but a role which plays a vital role in the treatment of our patients. Aloha.